Day.
Every day.
Every day.
Because we will
get through this together.
I'm Robin Roberts. Now more than ever, there's a need to feel hopeful.
Marty, it's a boy. Yeah. Definitely a boy. Definitely.
It's a boy. Virtual childbirth. Separated by pandemic precautions. Mom is in labor. Dad is one state away, watching the birth of his first child remotely. A moment of triumph for a couple that suffered 3 miscarriages. Menacing milestone. More than 50,000 American deaths from COVID-19, nearly all of them this month. A rising death toll as communities now contemplate reopening. Food shortage. The overwhelming number of Americans going hungry tonight. States and disinfecting companies are now issuing public warnings after the President of the United States suggested injecting cleaning products were a potential solution for fighting the coronavirus. He now says he was being sarcastic. Testing America. One lab's efforts to develop testing with rapid results. Some scientists are calling it a potential game changer. Tying the knot during a pandemic and social distancing singles starve for connection. An in-depth look at love in the time of coronavirus. Good evening, everyone. I'm Lindsay Davis. Thanks so much for streaming with us. 50,780. At last check, that's how many lives have been lost in this country to coronavirus in just over 1 month. Just to give that some perspective, that's the seating capacity of Yankee Stadium. It's just over 50,000. And think of it this way. It's also more people than the number of Americans killed during 9/11, the Afghanistan, Iraq, and Korean wars all combined. As that death toll continues to rise, several states are now rolling the dice in a move to jumpstart their economies. It's a gamble that could pay off or one we may all regret. It is a critical moment for states like Georgia, home of the world's busiest airport, where the governor has issued guidelines to open up. Our Steve Osunsami leads us off from Atlanta with what's happening there and what it could mean for the rest of us.
Let's get this started, right?
This is reopening day in Atlanta after weeks of trying to pay her bills with empty pockets and closed doors at her hair salon. Small business owner Regina Herschel was excited and nervous today. When the governor announced it, what was your feeling when you heard that?
Oh my goodness. I was excited because I felt like, oh my God, now I have a chance to at least try to work so that way I can provide for my family. So I was excited about it, even though I am still nervous. That's a natural feeling. I'm nervous when I go to the supermarket. So it's the same kind of nervousness, but I still have to work. Good morning.
She still has to work with rubber gloves, a plastic shield, and a mask under that. And on this first day of a return to commerce, she was booked solid. This was her first customer in more than a month.
I trust my stylist to take the necessary precautions to keep me safe, and that's what she does. And then just listening to, the news and the media that tell us what to do to stay safe. So I'm not nervous about the process at all.
Okay.
At some barbershops, people were standing in lines outside. They weren't allowed to stand in the shops. In the Atlanta suburbs, partners Mark Damaso and Brent Upton are reopening today, too.
We're only allowing one client at a time per stylist. Our stations are already 6 feet apart, so we're covered there. No one will be allowed in the salon while they're waiting. No one allowed in the salon with the person who's getting a service. So if they have anybody with them, they'll have to stay in their car. We're going to text our clients to come in once we've sanitized and prepared for them per client.
They spent 24 years building their business and nearly lost it after 5 weeks of empty chairs at their salon. They're pre-screening clients for colds and coughs on the phone and taking temperatures when they arrive.
If you thought the toilet paper situation was crazy, wait till 300 million people want a haircut at the same time. So,
and that's what's happening?
Yes.
But you guys are booked for 3
solid weeks straight.
Wow.
Since the salon is reopening, we want to go ahead and get all of those rebooked. So just give us a shout.
When the governor was announcing, it was Monday, before he finished getting it out of his mouth, our phones were blowing up. Texts, calls, I want to be the first, I want to be in. Because we had 5 weeks of clients that missed their appointments, and they all went back in.
This was the announcement Monday from Georgia's governor, saying that based on a flattening of coronavirus cases, declining ER visits, and enhanced testing, it's now safe to begin reopening certain businesses with specific restrictions.
We will allow gyms, fitness centers, bowling alleys, body art studios, barbers, cosmetologists, hair designers, nail care artists, estheticians, their respective schools, and massage therapists to reopen their doors this Friday.
And the governor has plenty of supporters, and some who didn't even vote for him, who point out that grocery stores, post offices, and home improvement stores are already open and crowded.
So I don't think it's too soon, no. I think it's about right on time.
I tell you, what's worse, going to a grocery store and walking down aisles with people, or whether it's being on your own bowling alley lane. I mean, we're not saying these businesses can, start having large gatherings at the bowling alley.
But at least one of the models health officials used to track the virus says that Georgia won't reach its greatest number of hospitalizations from the coronavirus until next week.
I worry less about models. I worry more about the reality. And right now, the reality is that we still have cases in the state. We still have a virus that is transmissible. And my recommendation to people is continue practicing social distancing, continue being vigilant, continue doing as little as possible, stay at home as much as you can. And the reality is you can prevent this from infecting you and infecting your family.
President Trump, a friend of the governor's, has even said that the state is opening too soon.
And I want the state to open, but I wasn't happy with Brian Kemp. I will tell you that right now.
The mayor of Atlanta wasn't happy either. She closed the city before the governor closed the state, and his new order overrules hers. Her city is home to the busiest airport on the planet that is now a ghost town. She says preventing an outbreak here is especially important.
There is nothing essential about going to a bowling alley or getting a manicure in the middle of a pandemic.
What many are now learning is that the governor of Georgia and so many other states are under immense economic pressure. On the day he announced the reopening, Governor Kemp was seeing the numbers in this new report. It shows that if the stay-home orders continued, the state government itself would wind up nearly $3 billion in the hole, on top of $1 billion the state is already behind. George Cheedy, a public policy analyst, says that the state unemployment fund could have run out.
And I don't think Georgia's alone. I think every governor in the country is about to have the same calculation, and the only question is how much money can they borrow and how much money did they already have in their unemployment fund.
Okay, now give me your personal opinion on whether you still think this is wise.
No, I think it's terrible because it undermines the rationale for public health decisions driving the question that we've got to face. Like either we are doing what the epidemiologists and the scientists say we should be doing, or we are not. Either we're putting public health first or we are not. If we're worrying about this before we're worrying about the health of a nail salon technician or an esthetician or somebody who works at a bowling alley, and we are saying that those lives matter less than whether or not our coffers are full.
A new ABC News Ipsos poll shows that 72% of Americans believe that moving too quickly to loosen stay-at-home orders is a greater threat to the country than moving too slowly. And 80% say they're unlikely to head out to public spaces that draw crowds. This is why Federico Castellucci says he's not opening his 7 restaurants for dine-in service come Monday, even though he can.
If we wanted to open tomorrow, we could open tomorrow. But the fact of the matter is it's got to be driven by the safety and the concerns of our team and our guests and the community, and just doing the right thing.
Even though you could make a lot more money opening.
Yeah, I mean, as it stands right now, I mean, we're not making money every day we're in business. We're literally just here to try to survive another day and pay our staff. But
Ford Fry also runs some of the largest and most popular restaurants in town. He says his staff is thanking him for keeping his dining rooms closed.
We got the news that we're allowed to open. Our gut and my gut, I'd say, and my whole team was like, we are excited that we want to open. We want to jumpstart the economy. We want to get things going, and we want to do our part and get our staff back working. But it was just the vibe in the city or the climate was that no one's ready to go out yet.
Mary Moore runs the Cook's Warehouse stores. She's had to lay off more than 40 people, and she too says it's not yet time to open her cooking schools. She's trying her hardest to sell online and limit the number of customers in her 2 stores.
I think the reopening, it feels premature. I mean, none of my staff is comfortable operating in a way differently than we are right now. I certainly wouldn't reopen the cooking schools. I don't think our customers are ready to come flooding back in the doors. Yeah. And so you can say we're open, but it's very different from actually being open. But the pressure that it creates to say that, I think is dangerous.
Yeah. Late Thursday night, Georgia's governor shared more guidelines for businesses that were reopening the next morning, limiting restaurants to no more than 10 people for every 500 square feet of dining room space, no more than 6 people a party. And at movie theaters, which are also allowed to open on Monday, people have to be seated at least 6 feet apart. The governor says he will enforce these guidelines and says if none of this works and there's an explosion of COVID-19 cases, he'll revisit keeping businesses open.
Experience flare-ups anywhere, we now have the tools to deal with that.
Georgia isn't alone. Oklahoma, Minnesota, South Carolina, Alaska, and other states are reopening some businesses today, over the weekend, and Monday. You can argue over the timing of it all, but there's no debate over the feeling. There is something emotionally relieving about escaping from our homes and our fears, where we can enjoy the little moments and possibly get back to our lives. Critics of the Georgia governor say he's taking a gamble with public health, but even his critics are hopeful that he's right.
We're joined now live by Steve Osunsami. Steve, you mentioned that ABC poll. The vast majority of Americans say that they support stay-at-home orders. From what you're hearing, do you think that reflects the general mood in Georgia?
I do. I think most people here agree with the respondents of that poll. But I will say that the minority opinion might be a little greater here because there are significant concerns about the economy. You've got a lot more people who need more help and a lot more people on those unemployment rolls that are a big concern to the state.
And how are lawmakers in states like Georgia balancing the desire to reopen with the reality that cases continue to rise?
I think that's the question. That's the problem. There isn't really an answer to that, and it's up to different authorities. Each governor is going to sort of make decisions based on the information that's presented to them, and some are going to decide to lean more in the direction of the economy, and others are going to decide to lean more in the direction of being concerned about the health risks. But at some point, we're all going to have to get together and figure out how we're going to best get our lives started over again.
Get together because we're in it together. All right. Steve Osunsami, thanks so much for that report. And we turn now to Washington, where President Trump is taking some heat after his remarks about the possibility of using disinfectants or sunlight inside the body to treat the coronavirus. The president now says that he was just speaking sarcastically to see how reporters would react. But the video of yesterday's briefing tells a different story. And today, those remarks prompted health officials and even the maker of Lysol to warn people against ingesting or injecting disinfectants. ABC's chief White House correspondent Jonathan Karl has that story.
Today, the White House is struggling to explain these comments by the president, where he suggested injecting a disinfectant could prove to be a treatment for COVID-19.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light. And I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting.
Get the right folks who could.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
The president was responding to an ongoing study by the Department of Homeland Security, indicating sunlight, warmer weather, and disinfectants quickly kill the virus on surfaces. We asked, are they really going to test it on people?
The president mentioned the idea of cleaners, like bleach and isopropyl alcohol you mentioned. There's no scenario that could be injected into a person, is there? I mean,
no, I'm here to talk about the findings that we had in the study. We don't do that within that lab, our lab.
The suggestion of ingesting disinfectants, something that would be dangerous and even deadly, has sparked a backlash. Lysol's parent company issued a statement saying, quote, "Under no circumstances should our disinfectant products be administered into the human body." Maryland's Emergency Management Agency says they received about 100 calls today on disinfectant use. Even the CDC weighed in, tweeting this picture and saying, quote, "Household cleaners and disinfectants can cause health problems when not used properly." Responding to the backlash, the White House press secretary at first said the president was taken out of context. Later, the president himself said he was just being sarcastic.
Clarify your comments about injections of disinfectant. They're quite provocative.
No, I was asking a question sarcastically to reporters like you, just to see what would happen.
But as you can see here, he was talking to the experts, not to the reporters, when he made the suggestion.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
Our thanks to Jonathan Karl for that report. Let's bring in ABC's Terry Moran in Washington, who's been monitoring President Trump's briefing tonight. And Terry, we saw in those statements from states, from the CDC, and from companies like Lysol that the president's words can have real-world consequences. And in today's briefing was quite the departure. We'll get into that in a minute. But, yeah, the real-world consequences, really kind of interesting, all the reaction.
A huge impact. The president absolutely has what Teddy Roosevelt...
We lost Terry Moran. We'll try and get him back, but in the meantime, we will move on. With so much information and misinformation coming at us every day, we're reminded of how much we still don't know about the mysterious coronavirus. So we want to take a step back and examine it all. What do we know now, and what critical questions remain unanswered? We'd like to bring in Dr. Simone Wildes, an infectious disease physician from South Shore Health in Massachusetts and an ABC News contributor. Thanks so much for joining us, Doctor.
Thank you for having me.
A new antibody study suggests that more than 20% of New York City residents have already been infected with coronavirus. Many had no symptoms and had no idea. So how does this information help researchers?
So it tells us that the infection has been around much longer than we anticipated. It seems as if, based on studies that were done earlier, that it might have been around since February in large cities such as New York, Philadelphia, and Boston. So it's been circulating in people who clearly didn't show any symptoms. They were asymptomatic. So it's been around for a while.
And those who've had COVID-19 or tested positive for the antibodies, are they now free to resume life as normal with total immunity from reinfection? And if so, does that immunity only last until this strain perhaps mutates?
So that's a lot of questions that we're still trying to sort out. It really is unknown. We do know that they have antibodies. The question is, how long is this antibody going to last? You know, in previous infections, we know that the antibodies can hang around for a long time. However, with COVID-19, there's still a lot of unknowns. And so I don't know if we can say the antibodies are going to last for a lifetime. I think that really is unknown. A lot of questions that we need to answer.
And for those who have recovered from COVID-19, what do we know about potential long-term impacts like neurological, kidney, or heart damage down the road?
You know, it has really been an interesting scenario for those of us on the front line like myself. Every day we learn something new about the COVID-19 infection. We're seeing a lot of cardiac issues, myocarditis. We're seeing blood clots. We're seeing neurological effects. I think we have a lot of studying to do to learn more about COVID-19. We really don't know what's going to happen later on to the patients who have survived COVID-19. A lot of unknowns.
A lot of unknowns, of course. And we've also heard of some rather unusual symptoms of COVID-19, like rashes on the toes, loss of smell, and also blood clots. Why do you think that those things are happening?
there is clearly some circulatory issues going on with your vascular system. So we are studying, why is it that these patients are getting these unusual symptoms, which we don't see in a lot of other viral infections. So definitely something that, as researchers, we're totally focusing our attention on that to see how we can better understand the disease.
And do you anticipate a second and potentially more deadly wave of this virus in the fall?
I think in the fall, we're definitely anticipating to see more COVID-19. As to how deadly it is, I don't know for sure. But one thing I want to encourage everyone to do, continue to practice social distancing, stay home if you're ill, make sure you wash your hands all the time so that we all can be healthy and ready and prepared when it comes around in the fall.
Doctor, thank you so much. Really helpful information there. And I think we have Terry Moran back again. We had that brief hiccup. It's challenging to do interviews sometimes over Skype, a little unreliable. But we were talking about the president's remarks, and we saw in those statements from the states, from the CDC, and from companies like Lysol that the president's words can have real-world consequences.
Absolutely, Lindsay. The president has what Teddy Roosevelt called the bully pulpit. That is the biggest, most powerful platform for delivering a message in the entire world. And in many ways, in a crisis, it is the president's primary job, first job anyway, to deliver a message of clarity and credibility to the American people, telling them what's going on and what the government is doing about it. And that message goes right around the world. So not only did you have, as you point out, the messages from Lysol, the makers of Lysol and the CDC and others, the government of Iceland, among others, issued statements saying, don't ingest or inject disinfectant into your body. It's not going to work. So this is essentially the president spitballing at best from the most powerful platform to deliver a message in the world. People need credibility. It is not a good idea for the president of the United States to peddle cures or medicines or spitball ideas about what might work, because the president's words are taken. The American people have a habit developed over centuries of listening closely to the president at a time of crisis and taking that word as gold. If the messaging isn't reliable, that actually has an impact on public health in this situation. And I think that is one of the problems President Trump has had here.
And, Terry, the president also a man of few words at today's briefing. Quite a departure from the normal scene that we see there. Let's take a quick look at the end of it earlier this evening.
And I truly do believe the day will soon come when we will heal our land and we'll be able to reopen America and put this great nation back to work. Thank you, Mr. President.
Thank you very much. Mr. President?
Mr. President.
Now this time for sarcasm.
21 minutes in the briefing room there today, and the president taking no questions. Is the general consensus that he didn't want to answer questions about his remarks?
And that's part of it. I mean, what was that? This is a president who has held forth from that podium for weeks now, hours at a time, 21 minutes. That's basically, he's just clearing his throat on other nights. This has been an incredible reality TV show. This is a president, who lived and died by ratings for years, and he loved looking at the ratings that these press briefings were getting. In some quarters, you could make the case that getting ratings was the biggest success of his life. More than his real estate empire was his reality TV show. And there it was, the briefing room, every night with the president center stage. However, in addition to not wanting to answer some very tough questions about what was he talking about with disinfectant, it would have been difficult for him as well. His aides have been trying to get him perhaps not to be so out front and ubiquitous for so long, because the ratings that matter, the polls, have suffered for President Trump the longer he's gone on. It does seem that the country kind of knows the shtick and is looking for something else, maybe that credibility and clarity that they need from presidents in a crisis, not a reality TV show.
Terry Moran, glad we got you back on. And when we come back, another Navy ship reporting a widespread outbreak of the coronavirus. And could the captain of an aircraft carrier who lost his job get reinstated. Plus, dealing with fertility issues is hard enough, but it's become a whole new challenge during this pandemic. The story of one couple's journey through this harrowing process and a potential game changer, an inside look at a lab that could do tens of thousands of COVID-19 tests in a day and deliver results in 24 hours or less. But first, here are some of the trending stories on abcnews.com. Welcome back. As some states take steps to reopen, the race is on to ramp up testing for coronavirus across the country. Since late January, more than 4.6 million total tests have been performed, but some experts say more than 5 million tests per day are really needed to safely reopen the economy by summer. Tonight, Devin Dwyer takes a closer look at a new type of COVID-19 test that some scientists say could be seen as a bridge to nationwide screening.
Some scientists are calling it a COVID testing breakthrough, a supervised but self-administered test for coronavirus from a sample of your saliva. Experts say if done properly, it could be as effective and much easier to perform than those intrusive nasal swabs by medical workers covered in PPE.
If you think about the opportunity around saliva, it can change the game. It's low risk. It's a different set of supplies that are needed.
ABC News got an inside look at one new oral fluid coronavirus testing lab in the nation's capital, a facility funded by the U.S. Air Force to test thousands of military personnel. Biotech startup Curative flying in the equipment from California, setting up the lab to test saliva samples in 24 hours or less.
That lab will be scaling to 50,000 tests per day of capacity over the next few weeks.
Right now, the military conducts less than 50,000 tests per week. The Defense Department calling the $13 million project a risk reduction alternative to nasal swab testing and potentially game-changing.
We have the ability to expand our testing capabilities to wider military populations, prioritizing the highest risk to forces and ensuring our strategic mission assurance.
If it's successful, experts say widespread oral fluid testing could greatly improve surveillance of the coronavirus across the U.S.
So we really have to change the toolkit, and that's where we really need enough testing, tracing, and supported isolation to control the disease so that we don't see resurgences.
So take the swab out of the packet.
We took the test to try for ourselves.
Now cough into your elbow deeply 3 times.
Coughing into the arm to release fluid from the lungs into the mouth, then swabbing the mouth for 20 seconds.
Make sure you're collecting all the places you might have some virus.
The swab goes into a tube of preservative and then sealed in a bag for transport to the lab. The test must be supervised by a clinician, but with proper social distance does not require extensive PPE.
There is work to be done to really confirm whether this approach is going to work well for the asymptomatic population. But as sort of a general availability of testing to have deeper knowledge into who has been infected, that will only help us in our fight against COVID.
Saliva testing is already being deployed in New Jersey, where Rutgers University has partnered with private healthcare firms to roll out the kits at hospitals and drive-through testing locations. While authorized by the FDA, the accuracy of self-collected saliva tests in general is still under review. In one study from UCLA, oral fluid and nasal swab specimens performed similarly when detecting COVID-19. But a third of infected individuals who swabbed their mouths without clinical supervision registered false negatives.
So this isn't foolproof.
No test is. I mean, we can't even get people to wash their hands for 20 seconds. It's not that easy.
But still showing enormous promise.
This may be a long-term model for how we could scale up a return to work effort across the country.
For ABC News Live, I'm Devin Dwyer in Washington.
Our thanks to Devin, and we still have a lot more news to get into tonight. Another day of severe weather in the South. Reports of tornadoes, hail, and damaging winds from Oklahoma all the way to Georgia, where that bad weather is heading next. Plus, with more than 26 million people recently out of work, unemployment claims are more important than ever. But in the state of Florida, delays and other issues are leaving so many stranded when they need help the most. And the state's governor now says that the system may have been designed to fail. But first, our tweet of the day. And please, don't drink bleach. More than 26 million American workers have applied for unemployment benefits since the COVID-19 crisis began, and many are still waiting for it to come through. Food banks all over the country are trying their hardest to keep up with demand, and if scenes like this long line of cars in San Francisco are any indication, the number of people who are struggling to put food on the table, it's growing. ABC's Victor Kendo has more.
Tonight, that stimulus bill signed into law by the president, pumping $480 million into the economy for small businesses and more than 26 million unemployed workers. Nationwide, 1 in 4 Americans say someone in their household has lost a job to the pandemic. In Miami Lakes, Florida, we met families in line for food.
Was it difficult to apply for unemployment?
Imposible. She says it's impossible. We met Fabiola Calero, a mother of 3 who lost her job and says she's given up on even trying to file.
You see those lines, they don't have paper, the system is down, everything like that.
While states are scrambling to process millions of jobless claims, Florida is one of the slowest in the nation, paying just 8% of the total claims submitted so far. After he and his wife lost their jobs on the same day at Fort Lauderdale Hollywood International Airport, Ernst Virgil says it took him 2 weeks just to file. He's still waiting for his claim to come through.
It is tough, but it is the reality here in Florida.
Checking Florida's unemployment website today, a message reads to check back on Monday. Many here at this food giveaway are doing what they can just to get by. Fabiola says it's like something out of a movie.
When you see a movie terror about pandemic and things like that, you don't think it's gonna happen until it happens.
Our thanks to Victor. Up next on ABC News Prime, one couple's struggle with infertility made so much harder by the outbreak of COVID-19. And getting coronavirus is bad enough. Imagine being banned from donating plasma that could help save someone's life or help them recover. One man says it happened to him just because he's gay. And Andy Cohen, the host of Watch What Happens Live, spoke out forcefully on his show last night after he says it happened to him too.
The FDA says there is an urgent need for plasma from survivors.
All donated blood is screened for HIV, and a rapid HIV test can be done in 20 minutes or less. So why the 3-month rule? Why are members from my community being excluded from helping out when so many people are sick and dying? Maybe because we're valuing stigma over science? I don't know. My blood could save a life, but instead it's over here boiling.
What you're seeing right now, this is part of the
The volume is down, but they're coming in sicker. They can be to the extreme where they have no pulse.
Number of U.S. dead from the novel coronavirus passing 50,000. Now the world's highest number of fatalities.
As COVID-19 continues to claim lives around the globe, the World Health Organization launches a collaborative project to find a vaccine and treatments.
We are in the fight of our lives. We are in it together, and we will come out of it stronger together.
In the latest study looking at antibodies, a survey found more than 21% of people in New York City have tested positive, whether showing COVID-19 symptoms or not. Researchers in South Korea say their antibody studies show promise that antibodies might prevent reinfection, but the long-term impact is still unknown.
After weeks of social distancing shutdowns, some states are moving forward with a patchwork of reopenings. Georgia is one of them.
When I booked the appointment, they went through all their procedures that we're going to be taking, and so I felt at ease.
The governor and the Atlanta mayor going head-to-head over whether to reopen.
Just stay home, listen to the scientists, and there is nothing essential about going to a bowling alley or getting a manicure in the middle of a pandemic. It is.
Today at the White House, President Trump signed a $484 million relief package. The new funds will supplement a massive $2 trillion relief package passed last month. Then the president telling reporters he's doubling down on his urging of medical professionals to look into using intense light to kill coronavirus.
They have to work with the doctors, but maybe there is something to light and the human body and helping people that are dying.
The president first made the suggestion, as well as suggesting that injecting disinfectant could be a treatment for coronavirus at last night's briefing. The White House now says the president's comments were taken out of context.
And now to the latest on how this pandemic is impacting our military. The Navy announced 18 sailors have tested positive for coronavirus aboard the destroyer USS Kidd in the Pacific Ocean. One of them medically evacuated to the United States. The Navy has deployed a specialized medical team for more testing, and the ship is headed back to port in the U.S. This comes as the Navy's top admiral today recommended the reinstatement of that Navy captain who was fired after sounding the alarm about the virus outbreak on his ship. But a final decision is yet to be made. Our chief global affairs correspondent Martha Raddatz has the details.
If the recommendation to reinstate Captain Brett Crozier is accepted, it would be unprecedented in naval history. Crozier pleading in an email to get the bulk of his nearly 5,000 sailors off the Roosevelt because of the rapid spread of COVID-19. When the email leaked to the press, Crozier was fired by Navy Secretary Thomas Modly. These images posted to social media of the captain leaving the boat to the supportive cheers of his sailors infuriated Modly even further, flying to Guam, where he disparaged Crozier in a recording obtained by the military-focused media outlet Task and Purpose.
He was A, too naive or too stupid to be the commanding officer of a ship like this.
Those remarks leading to Modly himself losing his job.
Our thanks to Martha. Imagine surviving the coronavirus and wanting to donate plasma, but being denied because of your sexuality. TV host Andy Cohen was visibly upset on his show last night after he was told he could not donate because he's a gay American. It's a topic that we've been following on this show, and Gio Benitez has more on the controversial FDA rule that comes under fire as blood banks are pleading for help.
All right. When 36-year-old Lucas Estock recovered from the coronavirus, he knew right away what he wanted to do to help others, donate his plasma rich in powerful antibodies to possibly help someone else recover from the virus.
If I were a viable candidate, I wanted to help. I just want to help.
He says the hospital told him he was a prime candidate and that he passed a New York City blood bank questionnaire. But Lucas, who says he's a healthy and qualified donor, tells us when it came time to donate, he was shocked by what he heard when he told them he's gay.
You will not be donating today.
Lucas said he was abstinent for 3 months. That's what the FDA requires for gay men to donate blood. On Facebook, he writes in a viral post shared more than 24,000 times, "I've rarely felt as embarrassed or angry or deflated as I did last week. Being told that the still too uncommon help I am able to offer during a global crisis is unwelcome simply because of who I am in this city in 2020. Fight back! Fight AIDS! Back in the 1980s, at the start of the HIV and AIDS epidemic, the FDA banned gay men from donating blood. At the time, experts say there was a lack of testing technology.
And the second was really just this underlying and the rampant homophobia.
Over the years, the FDA relaxed restrictions, saying gay men could donate, but only if they've been abstinent for a full year. Earlier this month, citing a shortage of blood donors, the FDA changed that deferral period to 3 months. But HIV specialist Dr. Monica Hahn says, in her opinion, that's no longer needed.
Our testing capacity has been truly revolutionized, meaning that we can really accurately detect the presence of HIV in patients about 10 days after HIV transmission occurs.
Just this week, Dr. Hahn and colleagues wrote an open letter to the FDA asking to lift the ban. More than 500 medical professionals joining in, along with the American Medical Association.
So the AMA has been a long-term advocate of using a risk-based approach rather than stigmatizing one group of people. So we believe there should not even be the 3-month deferral, but that we should use a risk-based approach.
Meanwhile, for Lucas, a happy ending. After his post went viral, a New York City hospital called him up and got that plasma donation.
I want an end to this ban. I want science and not stigma to determine donor qualifications. All any of us really want to do is help to try and save lives during a global health crisis. We just want to help.
The New York Blood Center, which initially turned him away, telling ABC News it needs time to train staff on new guidelines and that we would welcome him to come back when we begin accepting newly eligible donors.
Our thanks to Gio. And now to a health story beyond the headlines of this COVID crisis. Across the country, women undergoing fertility treatments have been forced to put their dreams on hold as hospitals and physicians scale back on non-emergency procedures. A harsh setback for so many, additional heartache in an already emotional journey. ABC's Ariel Reshef reports.
And I knew going into this appointment that there was a really good chance they were going to cancel it.
The heartbreaking burden of the COVID-19 crisis stretches far beyond fighting the virus itself.
COVID-19 has basically put a halt into everything that we've been striving for over the last 3.5 years.
For Tara Engelberg and her husband Glenn of Colorado, their grueling struggle with infertility has come to a temporary crossroads.
The fertility treatment for us is really possibly the only way we may ever have a child. And we were days away from our treatment when COVID-19 put a stop on our care.
The dangers of the pandemic prompting hundreds of doctors nationwide to scale back fertility treatments out of concern for the safety of their patients and staff.
Since we were in the middle of our treatment, at that time, we did have a choice. And it was terrifying to be in that position where you know probably the best outcome for everyone is to stop treatment. But your heart is just so broken because this is what you've been waiting for.
Tara has been candidly documenting her story on Instagram to connect with others, shooting this video just after that visit to the doctor.
And I'm perfectly, okay with it because I know it's what's best.
A painful pause to a journey already fraught with anxiety and anguish.
It's just unknown territory and very scary times.
It's a very scary and emotional roller coaster.
Infertility affects more than 10% of Americans between the ages of 18 and 44. Dr. Glenn Chapman of Weill Cornell Medicine in New York is among the fertility specialists who dramatically reduced procedures, a decision not taken lightly.
We actually saw the writing on the wall. We saw the number of cases going up exponentially. We saw that there was no cure for this disease. There was no treatment for this disease. I think there's a trade-off there that being socially responsible and having a pause in treatment for a short period of time was the right thing to do.
For Dr. Chapman's patient, Catherine Menges, it's another challenge as she tries to start a family on her own at the age of 42.
It's like once you make the decision and you start that ball rolling, any additional obstacle that comes, I think it really throws you for a loop.
How difficult is it to have this conversation with patients who are already going through such an emotional journey?
It's very difficult. Everyone is time sensitive, and infertility is a disease. Let's get that out in the open right now. This is a disease that needs to be treated. This is also time sensitive, where months and years make a difference in the chance that a couple or an individual will be able to conceive at all in the future.
Physicians forced to balance that urgency in the midst of so many unknowns. Data is extremely limited on how COVID-19 affects women trying to get pregnant.
If somebody got sick during stimulation and they were hyperstimulated, or they don't know the effects of this virus on early pregnancy, we didn't think it was in the best interest of the patients to continue treatment. Now, that was a hard decision. It's not an easy decision to make.
But despite the unforeseen delay, Catherine is staying upbeat.
I think I'm staying positive, and I'm looking forward to starting back up again.
But are there reasons that you're hopeful?
But hope is what keeps me going.
But I think, we are hopeful that we're in good health. We're still, relatively young, everything considered. And we know that the future is bright, even though it doesn't always seem that way.
Is there anything else you would say to other women going through this right now?
I would say that you're not alone.
Ariel Reshef, ABC News, New York.
And we certainly remain hopeful on their behalf, and our thanks to Ariel. When we come back, love. In the time of corona, the world may have changed, but people are still dating, still falling in love, and still getting married. But now it just looks a little bit different. Plus, children can have a unique and often heartwarming way of looking at the world, and the pandemic, it is no exception. Stay with us. Welcome back, everybody. Quarantine is a good reminder. Don't marry the one you can live with. Marry the one you can't live without. Marriages are being tested. Reports suggest divorces could spike. Weddings are in limbo, but love persists. In times of sickness and in health.
Do you promise to love, honor, cherish, and keep her for as long as you both shall live? If so, say I do.
I do!
Vows are still getting exchanged.
There was hand wipes, there was hand sanitizer.
After all, this is the moment so many dream of their entire lives. To have and to hold, just not too close. Some weddings planned a year more in advance suddenly face derailment by the pandemic.
So we're supposed to get married in Hawaii.
Such is love in the time of coronavirus. No empty pews here, and no need to urge these attendees to speak now or forever hold their peace.
They're still with us in spirit, even if they can't be in the building to watch.
At weddings worldwide, a new tradition. Forget something borrowed and something blue. Ceremony staples now include face masks. Even obtaining a wedding dress is now more of a challenge.
Want to run out and help. But...
You can, yeah.
You might consider it the first major test of holy matrimony. These newlyweds in Utah solved their wedding day dilemma with a drive-in.
They can all just sit in their cars and park like it's a drive-in movie.
Move over, Lover's Lane. This car park is about commitment.
They just had to change their radio station and they could hear everything that was going on.
Opting to reschedule? Princess Beatrice has done it 3 times. Some are taking this route of the wedding parade.
I'm definitely spending less money, thankfully.
Single people are also spending less money. Turns out difficulty dating is another unwanted side effect of the coronavirus.
Bumble a lot, some Tinder, also Instagram. You can just DM people and I don't know.
Singles still trying to reach out while stuck at home.
Maybe we can talk about something that's unrelated to the virus.
It's oh, I don't know if I can see you because if I do, potentially I might die or you might die, your grandpa might die. That's not sexy.
Definitely nothing sexy about COVID. Some surmise virtual dates could lead to more authentic interactions.
They're in the comfort of their own space. They're not worried about what they're wearing or what they're doing with their hands.
Less intense, more intimate.
He's got this giant surgical mask. I'm hey, I know you can't really tell right now, but I'm smiling.
And remember Jeremy Cohen?
You look beautiful!
Stealing hearts in his pursuit of Tori, his quarantine cutie, upping the ante with each date and taking us all along for the ride.
I would argue that it's a better time to date now than ever. It's so nice to be able to get to know someone and talk to them a lot before you're meeting.
The urge to break those stay-at-home orders, a lingering temptation Dr. Anthony Fauci addressed on Good Luck America.
If you want to go a little bit more intimate, well, then that's your choice regarding a risk.
We've reached the point in quarantine where the exes have started reaching out.
And in these desperate times, some are even revisiting old flames.
Because they already know you. You already know what's what. They already know what's what. Let's just do that. We're just chatting and there may be a pic or two shared.
Whether you're single or hitched, being stuck at home 24/7 isn't easy. Just take it from comedian Wanda Sykes.
We in some new territory. Ain't nobody signed up for this. This is crazy. No one.
Modern Family's Sarah Hyland has her own approach.
As soon as your eyes shut, I'm going to punch you square in the face.
We're seeing old love, and it's worn out. They're finding themselves just drinking at home and being frustrated. They're getting divorced on Zoom.
After being cooped up all this time together, some reports indicate once this is all over, the separation may be permanent.
I think the divorce rate is going up.
Most people don't know what their spouse is like at work. Now their spouses are seeing it. Sometimes they find it exciting. Sometimes they find it repulsive.
But there are glimmers of hope even from the front lines of this pandemic. A doctor taking time for what was supposed to be her special day.
And I promise to always be up
for anything, even an impromptu wedding ceremony.
Nurses pictured battling the coronavirus together, with the hopes that one day we'll see scenes like this one in Wuhan, a proposal for a nurse returning home. Love conquers all, they say, apparently even coronavirus. Children across the globe are, of course, confined to their homes, cut off from the outside world, and they have been turning that experience into art. As David Wright reports, these images remind us all that no matter where you are or who you are, right now, we all have so much in common.
What do you miss most? What are you scared of? What is it that makes you thankful? Around the world,
Ich bin der Tom, bin 6 Jahre alt.
Never mind the language barrier.
أنا اسمي حلا السعور، عمري 4 سنوات، بحب أرسم.
Kids have no trouble expressing themselves.
I'm 12 years old. I live in Tokyo.
Yaya and her little brother Reiku drew pictures of the people they missed the most.
友達と遊んでいるところを描きました。今一番やりたいことは友達と遊ぶことです。
In Germany, 6-year-old Tom and his brother drew their grandma and grandpa's house. In Budapest, 8-year-old Ivan and his brother drew pictures of soccer balls. In New Delhi, 10-year-old Shaurya drew the logos of his favorite restaurants.
I drew Starbucks, KFC, McDonald's, and I drew my school because mostly they're the 4 most important things, except my friends also.
Lots of kids are drawing the coronavirus itself. For an Israeli, like 4-year-old Mila in Tel Aviv, or a Palestinian, like 11-year-old Lohain in the West Bank, this is one threat they share. In Damascus, Syria, 4-year-old Hala imagined her coronavirus among stars and planets far away. When it does come, she figures, she and her brother have masks and decorations ready.
My name's Lydia. I'm 10 years old, and I live in New York City.
Worldwide, this lockdown has robbed kids of the joy of friends.
I miss being social with people, and I drew this picture of me selling lemonade and what it could be like after. And selling lemonade is an example because you can actually talk to people and interact. Now, because of lockdown, you can't really see people.
But it's also been a welcome chance to reconnect with family. Children make up roughly 1/4 of the world's population and all of its future. A future full of ballet slippers and sneakers, swimming pools, elephants, and rainbows. The universal image of hope after being stuck inside for a long and rainy day. David Wright, ABC News, New York.
Love to see those rainbows. And before we go tonight, the image of the day. We've seen images of people visiting nursing homes on ground floors, but what about when your loved one is too high up to yell? Well, take a look at this. This is in the Netherlands, where a company made a crane available for free for a day so family members could visit their loved ones in isolation. And that is our show for this hour. Be sure to stay tuned to ABC News Live for more context and analysis of the day's top stories. I'm Lindsay Davis. Thanks so much for streaming with us, and have a good weekend.
What you need to know right now: confirmed cases of COVID-19 climbed to 2.7 million around the globe. The Congresswoman on the front lines pushing the CDC for more detailed data on COVID-19's impact on communities of color. Getting the job done, our special series on the essential workers making a life and death difference. Today, what drives this car service worker and the pilot pivot